When people think of Niagara Falls, they think of the falls themselves, made of the mist, tourists, wax museums. But we're not in that part of Niagara Falls. So this part was fairly run down. There was nothing in this building before us for the 20 years prior. Many of the people who live in this neighborhood have barriers to employment, to housing, to healthcare, and in this case, dental.
This project is a facelift for the community, and people are excited about it. I was a dental assistant for 12 years. It's similar to this. You're on your feet all day. You've got to pay attention to detail and hold your arm in one position for a long time, you know. I saw how big of a need there was, especially in lower income communities, for access to dental care.
Doctors would come to me continuously and say, hey, I've got patients or clients, their main issue is mouth pain, and there's literally nothing we can do for them.
At the University of Toronto, we're offering dental care at no cost to working poor families and developing research around access to dental care. 1 in 5 individuals don't have any type of coverage for dental care, so that's 20% of the population. The first option is to suffer, right? And that is, to me, not acceptable.
Almost out of the blue, the province decided to invest in seniors' dental care. And then we started having conversation with Green Shield and talked about what we would really like to kind of bridge the gap kind of across the adult spectrum. Our team was so excited to be able to add this big piece to our puzzle around dental services.
So we've been slowly ramping up and getting ready to welcome Green Shield patients.
There are people that haven't been to dentists in 25, 30 years. It affects how they view themselves. It affects their ability to get jobs.
Oral health and dental care, it's part of overall health. And I feel like, all Canadians should have access to that. And, if I can play a small part in that, that's what I wanted to do.
Just the process of creating the mural has caused all these opportunities, have all these great conversations about what's going on in our building.
We didn't know that there was a clinic right here.
We are like, we should be there, we should know what it is about. And after knowing that it's about public health and dental services, it's really great.
People come up to us while we're working at the wall and just comment, it's looking good.
The mural is going to play a big part in that because people are now starting to ask questions. There's starting to be conversations.
I think it's beautifying part of Niagara Falls that hasn't always been considered beautiful.
The Niagara Clinic is an opportunity to expand the research and helping us understand what happens to individuals before and after they receive care that they otherwise might not have been able to get.
When you help somebody walk out with a repaired smile and you can see that their overall spirit and energy is way improved because now they can smile confidently.